And now to conclude the forum, I'd like to invite Dr. Joe Mitchell, who is the Director of Population Health at the Ministry of Health, to come and to give us a synthesis of this morning's discussions and to conclude the forum. Thanks, Joe.
Good afternoon, and I realise that we're at the very, very end of this session, so I'll be very brief in my summing up, which I think it's been a forum which has spanned a whole range of presentations, a range of perspectives. But the thing that I thought that I would do is bring us back to the three main themes that were put up as for guiding this session. And the first was about the case for action. And I think quite clearly the case for action was very eloquently put forward by the experience in New York, where Karen Lee very eloquently told us about how we are revisiting the concepts of the old public health, or in the case of planning, the origins of town planning, to look at how our urban environments are now impacting our contemporary health issues. So we've heard about also the co-benefits of health and been reminded that even though, you know, for me, my particular interest is the health perspective on these issues, but there's also environmental and economic benefits as well. And what actually brings us together are those synergies and are those different angles to looking at the same problem. We also heard that a range of approaches that are taking place in New York have actually reaped some benefit as well. So the scene's very nicely set then to move on to a framework for action in New South Wales. And we've heard quite recurrently that we have New South Wales 2021, which is the government's commitment to a range of priorities. But then we've also heard about the different agency strategies and plans. So, for example, the metropolitan regional strategies, the long-term transport master plan, and then within the health sphere, we've heard about the healthy eating and active living strategy. And one of the things I'd like to point out about this strategy is that it has four main themes, one of which is around environments for healthy eating and active living, and there's a focus on food environments as well as the environments for physical activity. And so this is an example of a cross-government plan which brings some of our interests together. We heard a number of examples of actions that are happening in New South Wales, and some which have been going on for many years as well. So we heard about the Oran Park Town, the new North West Railway link, the Western Sydney Parklands, as well as the recreation trails, the work of the PCAL in terms of the active living guidelines, and also along with this came the perspective of academia and thinking and reminding us about the benefits and the role of evidence in informing the work that we do, but then also being able to demonstrate that broad range of benefits as well. Then we were looking at the issue around leadership and action, and the Premier's Council on Active Living is clearly in this space a council which brings together a range of interests, and it does have very high level of political support. And we're reminded that partnerships and collaboration are really important, but again it's about making sure that the different interests of the different groups have that equal airtime, and in fact it's by actually working and collaborating and actually looking at, well, how do the benefits from a health perspective or a transport perspective, how do those things come together? And that's when it's more likely that you'll have collaborative action. But we're also reminded that it's not just about the agencies working together, it's about a whole range of other organisations and perspectives. Clearly, the perspective from communities, the academic element, as well as business and non-government organisation. And then finally, I think the reminder that we're all doing a range of work which I think we can be very proud of, but part of our responsibility is how we communicate that through our own organisations, but also into the community. So in closing, I'd also like to thank the National Heart Foundation for making this happen, and the Premier's Council for Active Living in actually organising today. But I'd also provide the challenge back to PCAL to look at, well, what do we do as a result of this? Because I think that the benefit of a forum like this is that it does get people talking again, and it does pick up on that enthusiasm, and potentially will mean that there are some other areas of work that we can continue on into in the future. So I certainly look forward to a stronger focus in the food sphere in PCAL, and a continued emphasis on active living and the environment. So thank you, everybody.